Hi everyone, I'm here to talk to you today about telehealth and occupational therapy. The objectives for this presentation are to define telehealth as it relates to OT, to discuss the alignment of telehealth with the Affordable Care Act and the triple aim of healthcare, to discuss current policies affecting the practice of telehealth, and then describe some proposed legislation currently in the House and Senate. Telehealth is getting increased attention from lawmakers around the country. Policymakers are trying to reduce healthcare delivery problems, contain costs, improve the coordination of care, and alleviate some provider shortages that came about with the implementation of the Affordable Care Act. And they're turning to telehealth to help achieve some of these goals. The American Telemedicine Association defines telemedicine as the use of medical information exchanged from one site to another via electronic communication in order to improve patients' health status. Telerehabilitation then can just be defined as the application of the telecommunication and information technologies in the delivery of rehab services. And telehealth can be seen as encompassing both telemedicine and telerehabilitation. The ATA does not distinguish between telemedicine and telehealth. They see those two terms as being virtually the same. The American Occupational Therapy Association sees telerehabilitation and telehealth as being essentially the same thing. They prefer the term telehealth because they feel it better encompasses the scope of OT practice, and so I'm going to use telehealth throughout most of the presentation today. Telehealth can be either synchronous or asynchronous. So synchronous would be if the client and provider are connected at the same time, such as a video conference. Asynchronous, on the other hand, is when the provider and the client are not connected at the same time. So something like this presentation, a pre-recorded video, could be digital photography or some other virtual technologies available out there. The benefits of telehealth are that services can be provided in a variety of settings where the client lives, where the client works, or anywhere else they may need services. This really allows for an increase in services in remote or underserved areas. It increases access to providers and specialists for these clients. So clients may have access to a general practitioner, but they may not have a choice of practitioners, and they may have limited to no access to specialists. So it helps remove a lot of barriers, such as social stigma, socioeconomic barriers, cultural barriers, and of course travel barriers. And this really helps prevent unnecessary delays in them receiving care. When I first heard about telehealth, probably a couple years ago, I thought, how can therapy be delivered virtually? It just didn't make sense to me. So in case any of you are having that same issue, I thought I would just give you a few examples of how telehealth fits with OT. Video conferencing, I mentioned already. This can be just a care planning or a care conference with a client and other providers and family. Telehealth can also be used with home assessments or worksite analyses. This is typically done with digital photography of the site, and then it's reviewed and modifications are suggested based on that. Could be done with a video conference, but much more likely to be done with the photographs. Evaluation in video segments. An example of this would be a client who is a child receiving services for handwriting. Video could be used to watch the child write, and then suggestions can be made on gripping, motor problems, seating, all different kinds of things based on the video segments. Telemonitoring technologies, this is when we're talking more about the smart homes. So an example would be a client who has dementia and would like to live at home. Maybe we put a monitor on the stove, see that he makes himself a meal, leaves the stove on and is unaware of that, and then that can be used to have a conversation about how to proceed with this client and what kind of care plan to establish. And then of course virtual reality, which are the interactive simulations available to us in therapy. So I think we all know the Affordable Care Act was signed in 2010 and then upheld by the Supreme Court in 2012. And I already mentioned that it increased access to healthcare for so many people. And of course, the telehealth fits with that because of the being able to deliver services in remote areas. I also wanted to talk about the Institute for Healthcare Improvement's triple aim of healthcare, which is an approach to optimizing health system performance. And So the three aims, the first one is improving the patient's experience of care. Again, when we're improving access, when we're preventing delays in service, this will, in theory, help the patient experience a better service. The second aim is to improve the health of populations, and again, when we're increasing access, in theory, more people will be healthier. And then the third aim is to reduce the per capita cost of healthcare. So providing services where people live and work, we're leading to increased efficiencies in the healthcare system, and in theory leading to decreased hospital admissions and readmissions, which of course will decrease the cost of healthcare. There were two groups established by the Affordable Care Act that I want to mention. The first is the Center for Medicare and Medicaid Innovation, CMMI. This group was tasked with engaging a broad range of stakeholders in identifying and testing innovative payment and service delivery models. They actually give out awards for innovation in healthcare, and their recent set of awards they gave out had many that included telehealth. So I think this is just evidence telehealth is here to stay and most likely going to be part of our future healthcare reforms. The other group is the Patient-Centered Outcomes Research Institute, which I'm going to call PCORI. Again, this was established by the Affordable Care Act. This looks at comparative efficacy research to help healthcare providers and patients make informed healthcare decisions. Again, a lot of their research is focusing on telehealth, so just more backup that telehealth is here to stay. The concern that I saw and that has been published in some AOTA literature is that in both of these groups, OT was left out of the healthcare team. So OT has not been included in this research. And this is a problem because the Affordable Care Act really opened doors for OT. It expanded our roles, including the role of OT in telehealth. And so the issue is that a lot of policyholders and stakeholders are just not familiar with how OT fits into this kind of non-traditional setting and what benefits we can bring to the table. So it's really up to the therapists to start educating policymakers and stakeholders in what we can bring to the table and what benefits we can help deliver. When I made that last slide, I thought, well, that sounds really good. And then I started thinking about it, and I thought, well, how do we do that? How do we get involved? So I looked up the websites for the two organizations. This is the CMMI. If you go to innovation.cms.gov, you can see webinars, participate in forums. You can share your own ideas with a messaging system they have. And you can also type in your state name, and a little map pops up. So I'm in Ohio, so I did Ohio. And you can click on any one of these little circles or squares, and it will actually tell you the name of the facility and what kind of model they're running. So I was really surprised. There were a few places I used to work, and I actually was surprised just by the number of these in the state, and you can see the surrounding states also some things going on. So it may be a little easier to find a location where this is going on and try to kind of get your foot in the door and start asking some questions and getting involved in conversations that way. If you go to the PCORI website and then click on Get Involved, a list of ways that you can participate comes up. Being a merit reviewer, joining an advisory panel. I'm sure some of these you need to apply for, but it's still nice that they're making it easy for you to figure out how you can get involved. Now we just need to do it. So some states actually have good telemedicine policies in place, but they lack enforcement and awareness, and so practitioners are just not participating. And so these telemedicine, kind of pioneering programs have had trouble reaching their true potential. 50 states, and there's 50 different telehealth policies out there. I looked up a gaps analysis, which was very interesting. It focused mostly on Medicaid, but it said that only 5 states in D.C. currently have a supportive policy landscape for telehealth. And what they meant by that was that they have the least barriers, and it's the most friendly environment for advancement of telemedicine. Medicaid agencies, though, are developing innovative ways to use telemedicine in payment and delivery reforms. I thought it was really promising that 48 states already have Medicaid programs that have some type of telehealth coverage. They looked at 37 of those. I don't know why they didn't look at all 48. I couldn't find that rationale, but they looked at 37 in this gaps analysis. and found that 13 and DC do not cover any telehealth rehabilitative services. But 14 of the 37 actually do reimburse for telerehabilitation services. So I think it's promising. I think that we're on the way. There's just a lot of work that still needs to be done. States are also trying to use telemedicine to fill provider shortages. So I mentioned earlier, all these people have access to health care, but now there just are not enough providers to care for them. So again, telemedicine can be used, but a lot of their policies have very limited language that's very limiting, and so again, we cannot realize the full benefits. For example, if I live in Ohio and I want to treat someone in Indiana or Michigan, a surrounding state, I need to be licensed in that state. And this is really counterproductive when we're talking about telemedicine, because in theory I could treat someone from any of the 49 other states, but I'm most likely not going to have 50 OT licenses. So it's something that needs to be talked about and looked at a little closer. The Social Security Act has a lot of language that is constraining to telehealth reimbursement for location, technology, some technology restrictions, and then they have a lot of covered code limitations. CMS is working really hard right now to change the language for the codes, not only with telehealth but some other areas as well. But we have to keep in mind that OT has one rep to CMS and PT has one rep to CMS, and so we really need to be involved in our organizations, our national and state organizations, and provide them feedback on what we need these codes to say and what we need them to encompass so that we can use them to the best of our advantage. The Creating Opportunities Now for Necessary and Effective Technologies for Health Act, or Connect for Health Act. This was introduced into the Senate in February of this year, and it is a bill that amends the Social Security Act, and it promotes cost savings and quality of care under the Medicare program through the use of telehealth and other remote patient monitoring services. This would be wonderful if it passed through. Again, it's only been introduced. It still needs to be reported by the committee, passed through the House and Senate, and then, of course, signed by the President. It's supported by AOTA, though, and it's also supported by 54 other organizations similar to AOTA. So people are really getting out there and getting vocal about supporting the use of telehealth. I looked it up on govtrack.us, and the prognosis for the bill making it through committee is only 1%, and it's only 1% chance of being enacted. So that was a little disappointing, but it was a very interesting site if you have a chance to check it out. It talks about their rationale and how they come up with those percentages. So I don't think we should be discouraged. I think we should keep trying to get the word out that we need this. But it is interesting to see kind of how these processes work. Now, in summary, there's a lot of opportunities for OT and telehealth. And current legislation, however, really limits our ability to realize the full benefits at this time. So we need to be advocates for our profession and increase the awareness of the benefits of OT in this arena. Thank you for listening.